The Cactus Foundation out of Arizona has been doing some really good education and baseline testing of young athletes and really trying to educate families and young people of what these are. High schools are starting to do education and requirements, but these are happening a lot younger ages, and they're happening in organized sport and non-organized sport and just play. And so we are educating parents better at the high school level. There's a lot of state laws that recover for organized sports, for managing concussions, but that doesn't manage these things that happen, in playgrounds, on bicycles, in that activity, and it's not addressing one of the major issues that we need to look at is even domestic violence and abuse of children and of just people in our community. I think the important thing is we need to start out at managing these in small communities and having good community-based treatment management, and then build from there. So we have to start out with, locally have people like the Cactus Foundation who's been doing baseline testing and having that and getting the education out to physicians, to people, to children. You start with that. We need to somehow get that all the medical records, the baseline testing for concussions, along with all other medical records. If somebody did a hospital visit and they had, there was a violence and abuse type thing, that needs to be known if you're trying to manage a complex issue like this, even in the school. So we need to be able to come up with a cloud-based medical records system that everybody can have access to, that can really allow for the best medical care that people can give. Because they don't want to talk about what happened previously, and they won't necessarily fill you in. But a medical provider especially needs to know that to give appropriate care, because it may give a red flag to say, oh, you've had this before. Oh, it wasn't quite this sports-related concussion, but you've had this bike accident as a kid, or there was a possibility of some kind of abuse. The medical provider needs to have that accessibility to that information so they can give proper care and say, oh, this may need something different than what I would have treated it if they didn't have those other things. So that's the key, really, that's the key in healthcare. We have to be able to figure out how to have medical records that are transferable to every provider who takes care of the patient, because if not, what we're doing is we don't give them efficient care and appropriate care, and we also give them, care that is actually quite a bit more expensive, because you'll be doing duplicate stuff that you may not have to do. And so as an overall healthcare community, the cloud-based medical record tracking system is a vital thing for our future in healthcare. We really need to look at future impact from head blows, from concussions, because what the data is pointing to now, that if you have a concussion, you are more susceptible to other things afterwards. And it's not just long-term consequences where people talk about the long-term, the Alzheimer's and Parkinson's and memory deficits when you get older and those type of things, and depression and anxiety. It's also short-term things. There's data pointing right now with you have a significantly higher risk to a lower extremity non-contact injury after you return after a concussion. There's data out there that looks to you have a 4-fold increase of a lower extremity injury within the first 90 days after having a concussion. So some of these other injuries that occur may be related to the brain is not back to its normal self. It may be healed where they're not susceptible to another concussion, but yet they're still susceptible to other injuries. And so we're having these other injuries that occur because our reaction time's a little bit slow, or our visual field's a little bit off. So what we're trying to do now, which is vital to begin to do, we need to start addressing these issues much earlier, where we're actually treating concussions. So we're treating these deficits we find. So we need to have people trained in evaluating to look for these deficits and getting them to understand rehab after a sports-related concussion. This idea of going and resting and then returning, and once you're feeling back to normal, you're back to normal. That's not accurate in most medical conditions. So it's definitely not accurate when you look at something as complex as a brain. So it's vital that we look at that more, and we have more people that can intervene to do these rehabilitation and active treatments, so we don't have these other issues that come up.